Hello, my name is MWillett, and I am a VTC nursing student in my RN year currently. And my topic is the state of the laboratory supplies at the VTC Wilder site. They are severely lacking, and I'm going to talk about my experiences there. So last year I was in my LPN year, and my fellow classmates and I, when training in the lab for our nursing skills, wound care, Foley catheters, giving IV fluids, we were using old, used supplies. And this made our experience not very authentic. There were golf tees plugged in the normal saline liter bags, so they could be reused, but this caused them to have moldy fluid in them, which definitely did not seem like the real experience. We would not be using that in the hospital. And as well as the sterile gloving. There were not enough sterile gloves for everybody, so we would rewrap the sterile gloves so they would be in an open package and used already when we would practice again and again. And sterile procedures are very stressful as it is, trying to maintain sterility, and when you know you're not doing it the right way, it's frustrating. The mannequins were good, and one mannequin especially, who we called Manny, was really neat because he could have different lung sounds and heart sounds, and we were able to listen, so that was really cool. When it came time to practice wound care, a classmate of mine actually had to bring in some supplies because they didn't have what we needed. And also she came up with some sterile bowls that we called sterile, but they were actually just little bowls, like ice cream bowls, wrapped in a paper towel. And it just made our experience not as good as we would have liked. And now that we are nurses and out practicing, this is not at all what it's like in the real field of nursing. So I just really think that VTC needs to spend a lot more money in their labs, and I'm only speaking about the Wilder site because that's the site that I went to and that we experienced. I'm not sure what the other sites are like, but I did send out a questionnaire to my fellow classmates, and a couple of them who had come to Wilder from different sites said that their lab was well stocked. So I'm not sure how Wilder got overlooked, but you know, as PN nursing students, we spend about $23,000 a year in tuition, and excuse me, there should be a lot more money put into our supplies. We're future nurses. We need to be training on everything that we're going to be actually using out in the world. Having plenty of sterile gloves, lots of unopened bags of fluids, working IV pumps. These are necessities. So I have a visual aid here. It's a little picture of what normal saline bags look like, and at the bottom where the stoppers are, those were plugged with a golf tee again, and it was moldy and rotting and leaking. And so in closing, I just would like to convince VTC and their powers that be to put more money into our Wilder site lab. We definitely could use a lot more sterile gloves, really good wound care, dressing supplies would be great, and that would be wonderful. Thank you.